together. If anybody has any questions, please feel free to drop them in the comment box and we will do our best to answer. My name is Nida Umar and I'm the Administrative Manager at EHE Health, where I oversee the day-to-day operations in the New York clinic. Today, we are joined by my colleague Navdeep, EHE Health's Quality Assurance Nurse Practitioner. Hi Navdeep, how are you?
Hi, Nida. Hi, everyone. Hope everyone is doing well today. So my name is Navdeep. I'm a quality assurance nurse practitioner here at EHE, and I am managing EHE's flu vaccination program this year.
Thanks, Navdeep. The flu season is upon us and it's a little bit more complicated than it has been in previous years. What does this year's flu season look like?
So complicated is a great word. It's definitely more complicated this year because it is the first season where we have the flu and COVID-19 coexisting at the same time. We have anxiety with COVID-19 has been high. It is a lot of unknowns. And coming into flu season this year, there is a lot of unknowns. First time we'll be seeing flu season with COVID-19 coexisting. So it just makes it that much more important to receive your flu vaccine this year and protect yourself, protect your friends, your family, and the community from the flu.
Absolutely. And why should one receive the flu vaccine and when should one receive the flu vaccine?
So anyone 6 months or older should receive the flu vaccine. Flu vaccine is available at 7 of our EHE's nationwide clinics and over 130 network partners. The flu vaccine should be received now. Is actually a perfect time to receive the flu vaccine between the months of September and October. It does take about 2 weeks for the flu vaccine to kick in and for your body to build immunity against the flu. And it does, so the flu vaccine can last effects up to 6 months. So now is actually the perfect time, months of September and October. Say we get it today, in 2 weeks, your body will build immunity with the flu vaccine and you will be protected for 6 months and for the duration of the entire flu season.
Right, and you mentioned, the difficulties with COVID and flu. So in this current climate, can one have both the flu and COVID, and how are the symptoms different?
So great question. And like I said, we're going into a first time going into the season with both flu and COVID-19, but the answer is yes. Both flu and COVID, they're developed from different viruses, and you can have both the flu and COVID-19 at the same time. Again, more important than ever to receive your flu vaccine, more important than ever to maintain um, precautions against both COVID-19 and the flu. Symptoms for the flu and COVID are also quite similar. They can overlap. So again, just as important to receive the flu vaccine this year. It can become hard to differentiate between the symptoms of flu and COVID as well.
Okay, and some of the symptoms of COVID are loss of taste and smell. How does that differentiate between the flu?
Yeah, so the flu and COVID-19, they're both contagious respiratory illnesses caused by, so the flu is caused by the influenza virus, and COVID-19 is caused by the SARS-CoV-2 virus, which is a new virus. Symptoms of both flu and COVID are similar, so you can experience fever, chills, sore throat, muscle aches, body fatigue, a runny nose, a stuffy nose, a cough, a headache. These are all symptoms that can exist with both the flu and COVID-19. And like you mentioned, a key differentiating factor between flu and COVID-19 is the loss of taste and smell. So research is still going on, but that is one symptom that exists with COVID-19 and not the flu. Precautions are needed for both, either if you get sick with the flu or COVID-19, or if you get sick, period. But if you experience the loss of taste or smell, it's more likely that you do have COVID-19 versus the flu. Maintain self-isolation, continue those precautions, and contact your healthcare provider.
Great. And what's the difference between COVID-19 and the flu? Is COVID-19 more dangerous than the flu?
Great question. So both can be dangerous. Both can have mild symptoms as well. So flu and COVID-19, they vary in their symptoms. You can be completely asymptomatic, meaning having no symptoms at all, not even knowing that you're carrying the virus for the flu or for COVID-19, or you can range to having moderate symptoms. So something that, makes you feel sick. And then that can also progress to hospitalizations and deaths. So both can be dangerous, both can lead to severe illnesses, both can lead to hospitalizations, and both can definitely lead to fatal outcomes and deaths, which is why it's more important than ever to get your flu vaccine and to continue those precautions.
So Navdeep, I'm a young, healthy adult. Do you really think I need to get the flu shot?
Great question. And, I, as a healthcare provider, I get that question year over year. I've never gotten the flu vaccine. Do I really need it? I don't want to get the flu vaccine. I don't want to get sick from it. But this year, it's more important than ever to receive the flu vaccine. As a young, healthy adult, you want to get the flu vaccine to protect yourself, to protect your family, your friends, and the community. Imagine a couple of months back when the COVID-19 had such a burden on our healthcare system. It was very difficult to handle all the COVID-19 cases. Now imagine COVID-19 and we have an abundance of illnesses, severe illnesses from the flu that can cause severe illness and can cause hospitalizations. We're not ready for that. Again, it's an
Right.
unprecedented time. We don't know if COVID is going to be rising again. So very important for you to get the flu vaccine, um, to again protect yourself, your family, your community, and to reduce the burden on our healthcare system.
Right. You're not just getting it for yourself, but your loved ones, people that you care about, the community. So we would
Definitely,
definitely recommend
definitely.
everyone to get the flu shot.
And I want to, kind of share some statistics with you as well. So in 2018 to 2019, there was actually 4.4 million cases of the flu in just America. So 4.4 million. Out of these, that led to 2.3 million medical visits.
Wow.
So now, there's a lot of apprehension. We want to maintain social distancing. So imagine on top of everyone going for their COVID test, going for their,
Right.
necessary medical visits. On top of that, you have 2.3 million medical visits for the flu. It becomes very
Yeah.
difficult. Out of
Yes.
those 2.3 million, we had 58,000 hospitalizations. And, like I said, both of these are respiratory illnesses. So, the fight we had for looking for ventilators and all of that, it coincides.
Right.
If you were to get severely ill from the flu and from COVID, you might need a ventilator, and it's a burden on the healthcare system. We've seen the number of deaths with COVID-19 this year, and they are continuing. We have hotspots throughout the country at various locations, but even the flu itself, it led to 3,500 deaths in the 2018 to 2019 flu
Right.
season. So again, it's important, and especially this year, a lot of unknowns, unprecedented time. First time we're having the flu and COVID-19 together. Get vaccinated, protect yourself, protect the community.
Right. We definitely don't want to put any more burden on our healthcare system.
Definitely, I agree with that.
Yeah, so there are some myths that surround the flu and the flu vaccine. For example, one of them is, can the flu vaccine cause the flu? What do you think about that?
Great. So yes, I agree. I definitely agree with you. That is a myth. So the flu vaccine cannot cause the flu. So the flu vaccine is actually an inactivated flu virus. It cannot cause the flu. What it in fact does is it allows your body to develop antibodies to fight the flu. Now, you might get side effects from the flu vaccine, such as local symptoms, such as redness and swelling at the site of
Mhm.
injection, a little bit of muscle soreness. You might get a mild headache, mild body fatigue. I get it every year. It's not that bad. You usually forget about it once you get the vaccine. You forget about it. But I do want to highlight that these side effects, these minor side effects, such as the redness, the soreness, the mild body aches that you may or may not experience, getting the flu vaccine is definitely outweighs
Right.
side effects. So the benefit of it, protecting yourself from it, definitely outweighs the side effects, and I strongly recommend getting the flu vaccine.
Absolutely. What about when people say, oh, the flu and the cold are the same thing? What are the differences between that?
Great. So the colds, commonly, we call it the common cold.
Mhm.
And the flu, they're actually different. So a common cold also produces respiratory like illnesses, but they're usually much more mild. You might have some sneezing, some coughing, a runny nose, sore throat. Those symptoms tend to develop a little slower, and those symptoms are usually less severe and mild than the flu. Many times, these symptoms are able to self resolve at home with rest, hydration, and
Mhm.
over the counter medication. The flu, however, you can get more severe symptoms. You will get fever, chills, headaches, body aches, fatigue, and discomfort. And it's usually a sudden onset, so you develop these symptoms and they usually knock you out. A lot of my patients, they need a rest for a couple of days. And we've had patients say that, oh my god, I experienced the flu this year, it was one of the worst things ever. I couldn't move for 2 weeks.
Yeah,
The flu can definitely be much more severe than the common cold.
right. And I do have a couple of questions here. Um, is it safe to get the flu shot during COVID-19? I think we're really recommending it. So,
Yeah, so definitely, we've all had increased anxiety with COVID-19. A lot of us, we're minimizing how much we're stepping out of the outside of the house, but it is definitely safe and it is definitely recommended to get the flu shot this year. Like I said, you can come visit any of our 7 nationwide EHE clinics to get the flu vaccine. We will make sure that you are safe. We are all using precautions. We are all wearing a mask, maintaining social distancing. Your local pharmacy is another place to get your flu vaccine, but it is definitely safe and recommended to get your flu vaccine. Maintain those precautions that you have been doing. Wear the mask, the social distancing, the hand hygiene. All of those are very important. But again, like we were discussing before, the benefit of the flu vaccine does definitely outweigh a lot of these concerns that some people may have.
okay. And what if I've never gotten a flu shot before? How can I expect my body to react? Will I get sick or will my arm be sore?
Yeah, so for the people that have never received their flu vaccine, I think this is the right year to start and to get their first flu vaccine. Many healthy individuals, like I said, don't even experience any symptoms. It is an intramuscular injection, the most common flu vaccine, and you might get some local symptoms. They develop towards the end of the day or the beginning of the next day, but they're easily, you can put some ice on it, kind of rest yourself, and there's symptoms that you can easily resolve. Nothing long term and nothing that should impact your daily activities of the day.
Okay.
Um, so, if you have never received your flu vaccine, go get it this year. It's definitely important and it's definitely recommended.
Okay. And who is at a high risk for the flu?
Great question. So it's similar to COVID-19. Individuals who are high risk for the flu are our vulnerable population. So the elderly, the young infants, the toddlers, and the immunocompromised. So anyone that might have a weakened immune system or whose immune system has not developed yet, such as babies, or whose immune system, elderly individuals weakened with age, immunocompromised individuals, anybody with chronic conditions, high blood pressure, diabetes, any respiratory
Right.
illnesses, any history of transplant, anybody with comorbidities, they are at increased risk for the flu, and they are also at increased risk for complications from the flu. So you might get the flu, but that can lead to further complications, pneumonia, bronchitis,
Mhm.
things that can lead to the need of a ventilator, the need of a hospitalization, and it can lead to a prolonged duration of illness. So to avoid all of that, to minimize the risk of all of that, again, we do strongly recommend the flu vaccine. It is very important. And like you were mentioning before, for healthy individuals, yeah, you might not have any comorbidity. You might say, hey, I'm healthy. I can fight off the flu if I get it. But God forbid you get it. And now, you're going to go visit an elderly family member, or you're going to,
Right.
go visit a young baby. You want to protect them as well. So getting the
Absolutely.
flu vaccine will not only protect yourself, like I said, but your family, your friends, the community.
Right. I do have a few other questions coming in. So I have some friends and family who are very against getting the flu vaccine. Is there anything I should be worried about?
So, we are always going to have individuals who do not receive the vaccine. First step, I would say strongly recommend them to get the vaccine, tell them about the benefits. And, if anyone is sick, if anyone has flu like symptoms, any respiratory like symptoms, avoid close contact with that individual. Maintain social distancing, 6 feet or more. Again, that applies with COVID and the flu. So if anyone is sick, try to just maintain your social distancing and avoid any close contact with them.
Okay. And I've heard with the COVID-19, it's harder to predict which flu strand will be more present this year. Does that mean I shouldn't get the flu shot?
Great question. So a little bit of good news is that so the southern hemisphere usually sees their flu season a couple of months before us.
Okay.
The precautions that we've been doing with COVID-19 are helping us in preventing the flu vaccine. They've actually seen a slower flu season this year, which is good news. And part of that is due to the precautions we take for COVID-19. In regards to the strands, so every year, so the flu vaccine protects us against 4 main strands of the influenza virus, and every year research is done, and the results of those research determine which strands are going to be placed in this season's flu vaccine to protect it. So there's a lot of effort that goes into the development of vaccines, and they are predicaments, but they're scientific predicaments, to include the strains that protect us against that sorry, so just to reword that to make it a little simpler. So the strains in the flu vaccine are the ones that are predicted to be present in the community. So the flu vaccine will protect us against the flu strains that are present.
Okay, that's great to hear. I do have a few other questions coming in. What are the key symptoms that differentiate the flu and COVID-19? I believe we spoke about that a little bit earlier.
So we definitely did touch upon that. Similar symptoms. They're both contagious respiratory like symptoms. So you'll have all of those respiratory, ear, nose, throat symptoms. A key differentiating symptom is the loss of taste and smell. Now, CDC and many organizations, they are developing diagnostic tests that will, so similar how we have nasal swab to test for COVID-19, they're developing tests so that, they can diagnose, tests for both the COVID-19 and the flu. So if you do have symptoms and, you're unclear whether you have the flu or the COVID, or any other respiratory illness, maintain self-isolation, continue those precautions, contact your healthcare provider, and they will most likely perform a screening test on you to determine what you have and if it can be treated. So for the flu, antiviral medication does exist, and it may be indicated based upon your symptoms and the exact presentation of your illness. And for COVID-19, as we know, it's more self-isolation and maintaining those precautions. And if if you're having difficulty with your symptoms, if you're having shortness of breath, if you're having an uncontrollable fever, contact your healthcare provider for recommendations to determine whether you can, resolve these symptoms at home or whether it's recommended for you to go to the emergency room.
And would you recommend someone to get tested for both COVID and the flu if they have, very similar symptoms?
Yeah, so in the past, we have a screening test for the flu. So you go into your doctor's office, they test you for the flu. And, over these past few months, we have developed tests to see if you have COVID-19. New tests are being developed that can test for both COVID-19 and the flu at the same time.
Wow, I didn't know that.
Yeah, so to actually one test that will test for both things at the same time. Again, connect with your healthcare provider. They're the ones who can provide you an individualized consultation based upon your medical history, based upon your current symptoms, and recommend, what kind of treatment that you should have.
Okay. And should I do anything, should I prevent doing anything that could hurt my immune system after the flu shot? For example, like drinking alcohol?
Yeah, so with vaccines, there's actually two main groups. So we have live vaccines and inactivated vaccines. So with live vaccines, that's like the chickenpox, measles vaccines. With those, we need to be a little bit more careful because the actual virus is inserted into you, and that's how you're building immunity. But with vaccines such as the flu vaccine, which is an inactivated vaccine, no precautions are needed. Like I said, you might experience very mild symptoms. Most people don't experience anything at all, and it does not impact your daily activities. So you can go about your day as you normally do, no precautions.
Okay, that's great. And just to add on to that, is it recommended that I can also work out as I normally do after the flu shot, or should I just give my arm a rest?
So great question. Like I said, so the flu vaccine can develop a little bit of muscle soreness at the site of injection. You can apply some ice and that will help alleviate some of the muscle soreness, but you can definitely go about your day as you normally would. Maybe let's not do arm exercises that day. We can focus on the legs or,
Right.
a different
Yeah.
exercise. But for most individuals, they shouldn't feel any difference. They don't feel any difference, and they can go about their normal workout routine.
That's great. Thank you, Navdeep, for all the helpful information. And finally, how can we really prepare for this year's flu season? Do you have any tips or any recommendations?
Great. Yeah. So, like we've been saying throughout this session, get vaccinated against the flu vaccine. Get vaccinated against the flu with the vaccine. Protect yourself, protect your friends, your family, your community. Lower the, we want to see a lighter flu season this year so that we don't overwhelm our healthcare systems. And, along with that, we're also seeing increased anxiety. Say if you do develop respiratory symptoms, there's a lot of increased anxiety. Many patients are going to be worried, like, oh my God, do I have COVID-19 or is it the flu? We want to decrease the anxiety with flu and COVID-19. So definitely get the vaccine and maintain the precautions that we've been doing. Hand hygiene, very important. Wash your hands with soap and water. When soap and water is not available, use an alcohol-based hand sanitizer. Very important. Continue wearing a mask. Whenever you're going out, wear a mask. Very important. Maintain social distancing when possible. So 6 feet or more. Maintain that social distancing.
Okay, great. And since you spoke about wearing a mask, will wearing a mask help lower my chances of getting the flu?
Yes. So actually, wearing a mask protects us against any particles that can exist. These viruses, can be transferred. And like we've seen, if two individuals are wearing a mask, that can significantly lower your risk of any virus and getting the illness from the virus. So like I was mentioning before, the Southern Hemisphere hasn't seen a significant flu season, and it's most likely due to these precautions. Wearing a mask, we're more diligent on hand hygiene than ever. Continue doing that. Wear a mask, social distancing, and hand hygiene. This is protecting you not only against COVID, but also the flu.
Okay, great. Let me just see if I have any other questions.
Yeah, and while we're waiting, I just have a couple of tips that I want to give to our viewers here today. So I know all of this, we have increased anxiety, flu season's coming up. We don't know what's happening. Schools are reopening. A lot of unknowns this year. 2020 has just been a roller coaster. But I want to, kind of close off with one note that self-care is very important. Focus on yourself, focus on your individual health. Make sure you're maintaining, 7 to 9 hours of sleep every night uninterrupted so your body's getting adequate rest. Maintain hydration. Make sure your body is fully hydrated. So if God forbid you were to come across one of these viruses, your immune system is strong enough to fight it off. Exercise is very important. Even moderate amounts of exercise can increase blood flow, which will improve your immune system and allow it to fight off any viruses or any other illnesses that it may come across. So getting the vaccination is very important, but self-care is also very important. Give time to yourself, to your health, to your diet, to your exercise. They all contribute to a good and healthy immune system.
Thank you, Navdeep. The information has been very informative. We hope to have helped guide a couple of people, and recommended them to get the flu vaccine. So thank you.
Of course. Thank you for having me today. Again, get your vaccine. It's available at any of our EHE clinics and network providers. Book your physical exam appointment and you can get your flu shot at the same time. Now is the perfect time, September, October, to get the flu vaccine so that it can protect you throughout the duration of the flu season.
I highly recommend getting the flu shot too. So thank you. Please make sure to, follow us on Facebook, LinkedIn, and Instagram, everybody, for additional content. Tune in next week for a new Rise and Thrive episode. Thank you all for participating and have a great day.
Thanks, Nida. Thanks, everyone.
Thank you, Navdeep.